Thank you for the wonderful introduction. I hope all can hear me. So, salam, namaste, and welcome. I hope all of you had your breakfast and morning beverages, and hopefully we can start the session. So, I'm here to talk about Ayurveda with all of you. But before we begin with this topic, allow me to set up some context. I'm a doctor of modern medicine. I don't have an Ayurvedic background. So, when I am approaching anything in this field, it's always with the maximum skepticism that you can imagine. So before we even let's talk about what's happening now. Apart from learning Greek alphabets till Omicron, COVID has forced us into this new reality, okay, where we are, whether it is the whole variants overwhelming the global healthcare system or the supply chain or anything, where we have to now ask whether we have to save lives or we have to save livelihoods. Okay, and coming to that aspect is where now I'm trying to understand what did the conventional medicine has got right. Okay, so apart from advancements in antibiotics, sterilization techniques, and a whole foray that has come with precision surgery, whether it's augmented reality now or the better imaging software that is coming in, which is giving precision surgery a whole new meaning. And also advancement in critical care technology has led to the average lifespan being much, much more than before. But what are the shortfalls in this? Having a long life, but having now surrounded by lifestyle disorders and psychological aspects, is the quality of this long life the same? That is one question that we are trying to understand. And now the whole point where antibiotic resistance is making a strong comeback. There is a whole case where a superbug will be a known bacteria rather than an unknown virus. And to address that, we also have something, the adverse drug reactions, which somehow do not even get talked about. And if you have seen anything from John Hopkins and all, so this now contributes to as the number 3 cause of diseases in the developed nations. But the elephant in the room is the growing cost of healthcare. So this is a pre-COVID data that from American Journal of Preventive Medicine. And if you can clearly see that how much the difference has come, where the green is what the numbers were in the green is in the 2016s and the blue is in 2000s. So we have an absolute increase and astronomically in the value of how much a patient is paying when he has a chronic case. But does chronic conditions affect only us in our old age? Okay, this graph is clearly letting me know that adult and millennials, especially older millennials, are showing an increase in chronic conditions, what I like to define as the diseases of abundance. So whether it is hypertension, whether it is obesity, diabetes, there's nothing but too much of salt, sugar, and fat in our system. And you also have the whole major depression taking over, and apart from that, substance abuse. So these are some things that we also need to address. And these COVID numbers, which are clearly showing that people with underlying conditions are experiencing much troubled hospitalizations, ICU admissions, and also fatal outcomes. So this all has led to an extreme global awareness on what wellness is. Wellness, if you really think about it, was something that would only be done by those who could afford it. Okay, so now this global recognition is, what does wellness mean to you? Does wellness, how do one approach wellness? How do one define wellness? So I have here a beautiful character from our past, just to give you context of how we approach wellness. Our entire premise is that there is this miracle cure out there, and there is an external solution for all our internal problems. And this premise is what I am trying to challenge. Somehow our habits are secondary, and that's what I can, just let me have one. Thank you for that. Okay, so what is health? WHO wants to say it's a state of being where you are independent of any disease, or it's a state of physical, emotional, and well-being. And wellness you can define as a deliberate set of lifestyle choices that you take to achieve that. But I would like to summarize in a much simpler way. So this dimensions of wellness is how we basically want to talk about. But I would like you to answer this in three basic questions to define what is your wellness status. The first question is, when I'm waking up in the morning, am I waking up with enthusiasm? Second question is, when I am going to sleep, am I achieving it naturally? And the third question is, am I able to excrete my bodily waste optimally? If any of those answers are no to any of those three questions, you do have a problem and you need to introspect. So if health is a destination, then wellness is a journey, is how I would like to define it for you all. So all this talk about this thing has led to this now resurgence where Ayurveda, yoga is making a comeback in a way that was never imagined before. And our now thing is what we are defining as the yoga and Ayurvedic renaissance. So now before I approach this point, again, we are trying to understand whether do we approach this as a religious system or do we approach this as a spiritual system. Okay, but I want to approach this how it was written. It is an extremely scientific, which is observational, science-based methods which they had used in writing the most of the treatises of yoga or Ayurveda. So the Sanskrit word for Ayurveda, it could be broken into two, where Ayur is meaning life and Veda means knowledge or wisdom. And I like to define it as the science of life and longevity. So here we have history of Ayurveda. The orthodoxy wants us to believe that 5,000 years back, one magical day, every knowledge came to us, and then we've been just sitting on our ass in India. But the fact of the matter is, just like any other science, it's been evolutionary. It has multiple contributions coming, not just from Hindu traditions, but also from Buddhist and Jain traditions, which have added to the knowledge of Ayurveda. So you can imagine 5,000 years of case history, which is available, but it is not being addressed in that manner. So the major text of Ayurveda, it's Charaka Samhita. So this quote over here is the first principal sloka or the first, what you would say, the treatise that comes in the Charaka Samhita. So Sasthasya Swasthya Rakshanam, which basically means how to keep the healthy healthy. Aturasya Vikara Prashmanam, which basically means, which I would like to say that prevention is better than cure. Okay, so Ayurveda always modeled itself in functioning as a preventive healthcare, getting the community approach right and getting individualistic approaches within. So there is no one size fit all in this thing. So if anyone who thinks that Ayurveda is vegetarianism, it's not. So what do you introspect with Ayurveda? So Ayurveda's entire purpose is to make us feel, ask the right questions, ask us how to talk to our own body or listen to our body and how to talk to your own mind. So Ayurveda forces us to take that time out to start asking those questions about yourself, which you have outsourced to someone else. So just imagine your own health, which totally depends upon you. We depend on someone else to come and tell us what to do and what not to do. And unlike how Ayurveda has been reduced to ancient herbology, and most of you, if you see Ayurveda, it is just glorified cookbooks. Ayurveda had a sophisticated classification ranging back 3,000 years, which mimics the current model medical systems, where you had general medicine, general surgery, psychiatric care, geriatric medicine, everything that you can imagine, which is out of there. So that was the level of sophistication that Ayurveda had. Apart from yoga and Ayurveda, our company at Shantigram Wellness, we specialize in something known as Panchakarma, which is basically the five-fold detox therapy. The whole premise of this thing is how to get the body to its natural state by using detox and cleansing therapies so that the body can repair itself. If you really look into it, whether it's a vaccine or antibiotics or anything, It totally depends on your own body's ability to do something about it. Whether you want to call them immunocompromised or anything of that sort, but how do we define immunity? There's so many questions now we are asking now since COVID has come. So here in the Panchakarma, I just want to talk about basically, so Vamana, Virechana, Nasya and Vasti are more like purgative therapies, which basically cleanses your natural external orifices, while Rakta Moshana is about leech therapy, which uses medicated leeches in certain conditions. So this picture you most have seen in a spa, if any one of you have gone. So this is the, literally I would like to call the brand ambassador of Ayurveda currently. It's actually a metered way going on to the, between your eyebrows. It's a metered flow. The whole idea behind this is activation of the pineal gland. Whether it happens or not, it's still subject to this thing. But combination of Shirodhara and Shirovasti, we have in the last 25 years able to help multiple patients with chronic depression, insomnia, anxiety, and anything which is stress related. So what are the problems which are being currently faced by the Ayurveda sector? So number one is the lack of peer-reviewed clinical studies or any sort of serious systemic review or meta-analysis or meta-reviews. And the other point is real-world evidence. So here the issue is whatever research of Ayurveda exists, it only considers the pharmaceutical aspect. So now suddenly you will be hearing about turmeric being the greatest thing to mankind, ashwagandha making this amazing claims about itself. So that's not how Ayurveda prescribes anything. Just a second. Ayurveda totally takes in consideration of your habits. You cannot approach Ayurveda without considering the whole daily, night routine, seasonal variations, and so many things. So just taking, having one of the worst lifestyles and taking turmeric and ashwagandha, hoping it becomes better is just like how the Popeye and spinach complexes. Like, you're not concentrating on whether you're a smoker, you're not smoking, concentrating on any of those habits. It's just that there is some spinach out there and I'll be good with it. Then the problem is of also perception. So I like to divide my this thing into three broad categories of what type of audience generally reaches out to Ayurveda. There is a type which, it doesn't matter what kind of evidence I present, will always consider Ayurveda as pseudoscience. Okay, and the second part is the audience which will always consider Ayurveda as all natural and will have no side effects. I do not agree with both of them. My point is to reach out to the agnostic among you who approach everything with their own personal experiences. So that is what I'm trying to outroute, that how Ayurveda, the perception needs to be changed, that it really needs to be approached as a habit-forming way of doing things. Next aspect is the lack of data scientific approach. So all the testimonials you might have heard about Ayurveda making claims and everything, there is a severe lack of how this data has been captured. Most of them could be considered in some ways as over-glorified testimonials. But this is where we are changing. We are creating systems which allows standardization and specificity to be brought into the data collection matter. So the solution that Shantigram has been working upon is this question, that is, what is modernization? Can we do modernization of Ayurveda and yoga? Does modernization mean westernization? Does modernization mean industrialization? So for us, we have answered it by modernization means innovation, progress, and constant evolution. And we have answered this by building our own biostatistical non-linear models. We are developing our own mathematical tools to analyze Ayurvedic outcomes, plus our own EMR health informatics system, which takes in the Ayurvedic aspects in development of these health informatics systems. And the third part is AI-based data analytics, where the holy grail being the predictive modeling in mind, which we are trying to aim for. So next point over here is, while we are all debating how technology can help, how AI, how better care technology and everything can make a lot of difference, the fact of the matter is, at the patient level, they are already practicing what we call as the medical pluralism. They are taking N number of medications. They're taking everything you can imagine, whether it is Indian, Chinese, whatever you can imagine, already being considered, along with their own modern medical outcomes. And so, in a nutshell, Ayurveda is an introspective way of approaching health. It is having one of the most sophisticated eco-physiological models in existence. It considers your own individualistic approach to healthcare. It considers community-based healthcare approach. It also considers how environment plays a big factor in anything and everything you do. So we are not just a social creature, we are a result of all these experiences coming together. And Ayurveda allows us to explore that. So with that, I would like just to quote, when I is replaced by we, even illness becomes wellness. And thank you all, you've been a wonderful audience. Thank you. Any questions?
Hello, doctor. Thanks for your presentation. Just want to add, what was your experience in conversion of the patients for the Ayurvedic treatment? Because
Could you be a little louder, sir?
what is your experience in terms of the conversions of the patients towards the Ayurvedic treatments? Because back in India also we experienced this, that when the allopathy treatments gets, kind of its limitations, then I start the Ayurvedic treatments. So I think how to break that mindset, and you just add on that.
So I will just add to that point. What I like to call the law of exotics. So if you go to an Indian household right now, the chance of you finding olive oil, sunflower oil in their kitchen is very high. But now if you go to an American household, you will find ghee and coconut oil over there. Okay, so it's always like, what is the exotic part? So in US, when we are approaching them, what we get as patients are basically allopathic rejects. Patients who could never find any type of relief or anything in anywhere. So when they come to us, they're really expecting miracles. And that's where I'm like, we are helping our doctors understand that what you are practicing is totally different from what the ancestors have practiced. Because when you are getting this patient, they have already been under all the side effects. The kidneys are totally gone. They're having a lot of issues with their liver. And so we have to get into this whole rejuvenative process before we can even talk about treatment. So our experience has been extremely overwhelming in the West. We have already mushroomed into 14 centers all out of US and Canada. So it's been great. Thank you.
Thank you for your presentation. Two aspects. I'm from Europe, and when we talk about Ayurveda, we see it in the wellness centers, in the spas, etc.
Yes.
And we don't actually link it to really good health. It's more like how do you say it? Something nice to do, like a massage or something. So we don't connect to what you're saying. A piece of advice, if you want to broaden the scope, I really like the aspect that you say behavioral patterns. And when you skip the word Ayurveda as such, maybe if to go in countries where we don't see it in your point of view, the aspect of behavioral patterns could be very much connecting to whatever you're saying in your story, because that's what we are emphasizing, what a lot of people are emphasizing. What we do on a daily basis has an impact on our future days. So just as a good advice, because we as Western medical professionals, we have a disconnection with alternatives.
So that again, our approach is not to present Ayurveda as alternative medicine, but as complementary medicine. So we are working with modern medical professionals based out of US and Canada in trying to create better tertiary care, and also trying to have so Ayurveda has this amazing way of, which I can say is aharam, acharam. So aharam is food, acharam is habits, vicharam is thoughts, and viharam. So these four aspects is how do I create the right community around me? So, I mean, if you go back to your home and everybody is in a very bad mood, it doesn't matter how good you are, you will get affected by that. And that is what we are trying to read upon. So we are currently trying to even fight this whole concept where Ayurveda and yoga has been reduced to this spark care kind of thing, and trying to showcase the treatment modalities that actually exist and a very strong curative principles that Ayurveda can present. Any more questions?
What is your opinion regarding the side effects? I just heard that, allopathic rejects are coming to Ayurvedic physicians or practitioners, and then you are expecting that they're of course having much more side effects already incurred after having been treated. Now, I don't see a molecule which does not have a side effect. It's just the threshold
Yes.
above which it can have side effect, below which it won't have that kind of side effect. So what are you doing in terms of the risk and benefit part of any product? I won't say molecule, because most of your products are from, I think, they are not molecular products. They are just products that are acquired from the nature or whatever you term it in your science. The only question is, how do you measure the risk and benefit, and what kind of trials exist for that till date? Because you are talking a lot about data, trials, evidence synthesis and other part. But for evidence synthesis, you need to have those data in hand from primary research, after which you can actually synthesize those evidences, combine them, and do meta-analysis and all other stuff.
So, wonderful question. Thank you for that. So, how I am approaching, how Shantigram is now approaching is, first of all, we had partnered with entities in biostatistics, AI, and health informatics in developing our own approach to Ayurveda. You cannot take an allopathic model and try to push it over. It has to be a non-linear model. It has to be real-world evidence-based model where, as I just mentioned, how do you track a yoga-based outcome? Okay, it has to be a continuous behavior tracking. You're seeing how many times this person is doing yoga, is that elevated? And trying to understand this thing will be trying to address to those problems like pain, like for insomnia. Only a patient can tell you whether they have felt any relief. You can have all the lab tests, but at the end, it's the patient who's going to tell whether he's having a better sleep or the pain is feeling better. And coming to the active molecule part, my question to you is, all of us will agree that honey has medicinal properties. But what is the active ingredient of honey, if I ask? Can anyone answer here? Okay, so you cannot break just fructose. So this dissectionary way of doing things, where we somehow make a claim that this is the active ingredient and nothing else matters, okay, that I kind of feel it's very problematic. And coming to the, how do I choose? So Ayurveda has an extensive list of indications and contraindications, which it just goes back all 3,000 years where, so there's no one school of thought. There are 12 schools of thoughts in Ayurveda where they are constantly arguing with each other. Okay, so we are being presented as that Ayurveda is like one book or something. We just have things coming out of it, but it's not the case. If anyone is an Indian, we are an extremely argumentative people. So we will never agree with any type of status quo. Even in those times, it was the same case. I hope I answered some part of your question. Yes.
All right, that has to be our last question.
Okay.
So I'm Dr. Paula Goyal. I'm from India. I'm a pediatrician and an adolescent specialist. So generally, I have high regards for Ayurveda. But what we have also seen, let me come ahead. What we've also seen is that many of the components of the Ayurvedic medicines, at least which we get in India, have a high heavy metal.
Yes.
And this heavy metal, especially your lead,
Yes.
bismuth, antimony,
And now cadmium also.
cadmium, causes a lot of problems. So how do you address that?
So
And another second question along with it is, when we are saying that they are rejects from the allopathic side, so my question to you is, a patient who's got a chronic disease, because they are the ones, especially the heavy allergy ones or the diabetic ones who have already got the problems are going to come to you. So how, from the evidence-based point of medicine, because medicine is now evidence-based, as we all know, even in Ayurveda, homeopathic,
Yes, it is.
any pathy which you take, it has to be evidence-based. Because you need to show your patient at the end of the day, they were at point A and they've gone to point B or C, which is in a better improved state. So how do you show that? So do you conduct any particular blood test? Do you do any imaging, or how do you do it?
So, ma'am, again, all this will prove the mechanism of action question over here. So how to do this is we try to track outcomes. Simple as that. Like if I'm trying to do a diabetes patients, I just have to tell you the blood sugar levels have reduced after taking a therapy. And coming again to the questions of pain and insomnia, there's really no blood test. Okay, so, and again to the heavy metal question that you had asked. So Shantigram is the first FDA compliant company where we rigorously test all our products for not just heavy metals of arsenic, lead, cadmium. We also do carcinogen, pesticide test and everything. So we have one of the cleanest products in the market.